Is breast cancer today treated the same as it was many years ago? Let me share some thoughts with you on that subject. I received an interesting question from one of our loyal followers. Let me read it to you. With all these advances in breast cancer therapies, why was my breast cancer treated the same way my mom's was many years ago? Well, I don't have a lot of details accompanying this particular question, but clearly the treatment of breast cancer has changed, certainly over the last 25 years, and particularly I think over this last 10 years. Today we have many more options that we didn't have, frankly, even 10 years ago. Now, what are the fundamental principles in the treatment of breast cancer? Well, the first principle is you've got to do local regional control of the cancer. That typically involves surgery, and it may also involve radiation therapy. Now, anytime you're treating the whole body with anti-hormone therapy or chemotherapy, that clearly has an effect on local regional control as well. Then in addition to controlling what's going on in the breast with a lumpectomy, mastectomy, radiation therapy, etc., you've got to treat the whole body. And we've known for over 30 years that you have to treat the whole body, and this typically includes an anti-estrogen pill if the cancer is estrogen receptor positive, and may also include things like chemotherapy. Now, what are some of the changes that have gone on in this last 10 years? Well, first of all, the advent of oncoplastic surgery has allowed us to get much better cosmetic outcomes than certainly we had over a decade ago. Other things that have really emerged strongly over the past 10 years is what's called partial breast radiation therapy. In other words, just locally treating where the cancer was in the breast. Now, this applies in patients who are having lumpectomies done. And a further refinement of partial breast radiation therapy is the use of intraoperative radiation therapy. And I've got several videos on intraoperative radiation therapy that explain what the technique is about, what are the indications for it, the kind of equipment that's being used, etc. So going back to this original question, first of all, I don't know how your mom's cancer was treated many years ago, and there may in fact be some similarities. Mastectomy is certainly still indicated with large areas of in situ breast cancer, or if the nipple or areolar area is involved. And so some of the treatments are the same, but certainly today we have many more options. Hopefully this overview will clarify why some treatments are the same, and yet we have more options today than we've ever had in the past. The Mobitron is a mobile, self-shielding linear accelerator used to deliver intraoperative electron radiation therapy for the treatment of breast and other forms of cancer. To learn more about this exciting and cutting-edge technology, please go to intraoperativemedical.com.